In this video we will talk about atrial tachycardias. Atrial tachycardias include focal atrial tachycardia, multifocal atrial tachycardia, and macro-reentry atrial tachycardia. In focal atrial tachycardia, the P waves are of the same morphology with a rate of more than 100 beats per minute. The rhythm is of discrete origin. Focal atrial tachycardia may originate from any site in either atrium. The P wave morphology are different from the sinus P wave morphology. The PP intervals are usually constant. Atrioventricular conduction ratio may be either constant, 1:1, 2:1, 3:1, or variable. The PR interval is often prolonged during tachycardia. Usually, QRS complexes are narrow, although bundle branch block may be seen. Sometimes the P wave merges with the T wave of the previous complex. This ECG shows focal atrial tachycardia lasting for 7 complexes. The first, second and 10th complexes are of the sinus origin. Other complexes are of the atrial origin and a mean rate of 125 beats per minute. Multifocal atrial tachycardia is an irregular rhythm with at least 3 different morphologies of the P wave. The atrial rate is more than 100 beats per minute. Some P waves may be not conducted. If the atrial rate is less than 100 beats per minute but there are 3 different P wave morphologies, multifocal atrial rhythm is diagnosed. The rhythm is highly irregular. Also, some variation in the PR interval is possible. This rhythm may be misinterpreted as atrial fibrillation, but the P wave precedes each QRS complex. There is at least 4 different morphologies of P wave on this ECG. Multifocal atrial tachycardia is often associated with pulmonary diseases and pulmonary hypertension, especially in those who take theophylline. Rarely it's seen in patients with valvular heart disease or coronary artery disease. Also, it may be a normal variant in infants. Macro-reentrant atrial tachycardia is characterized by regular discrete P waves with an isoelectric line in between. It's long-lasting like atrial fibrillation or atrial flutter. The atrial rate is usually less than 1 in atrial flutter. It's most often seen after cardiac surgery, extensive catheter ablation and in patients with congenital heart disease. This ECG shows atrial rate of 194 beats per minute. P waves are most obvious in lead V1. There is irregular ventricular rhythm due to variable atrioventricular conduction with a mean rate of 45 beats per minute. Thank you for watching this video. Please like and subscribe.